This workshop is being recorded, as you can all see. And this workshop is being sponsored by Columbia's Global Consortium on Climate and Planetary Health Education and the Sustain Our Abilities organization, and also by the International Society of Physical Medicine and Rehabilitation. Last week, we talked about climate change and disability. What are the health and ability concerns? And today we're going to be speaking about rehabilitation therapies and climate change, what the special considerations are. We've got 2 more sessions coming up next week and the week after, so please stay and be a part of these sessions. And as we start session 2, I want to have the viewers just think back to last week. We did talk about one issue, and that was everyone coming up for their own actionable item regarding climate change, disability, and rehabilitation over this next couple of months. So please, if you haven't been here before, you're able to watch the previous session online, and we'd love to have you keep thinking about that and working forward through this process. Today's agenda is going to involve short presentations by 3 wonderful speakers, and after the presentations, we will have case studies and a Q&A. Our 3 speakers come from diverse backgrounds and diverse disciplines. So we're going to be starting out first with Dr. Adesola Adola. Dr. Adola is an associate professor at the Department of Physical Therapy at the College of Medicine at the University of Ibadan, Nigeria. She is passionate about improved access to healthcare for persons with disabilities in underserved communities, and a strong advocate for inclusivity of persons with disabilities in the push for climate action in Nigeria. She's on the Sustain Our Abilities Advisory Board and that of Rebuilding Hope on Wheels. Dr. Andrew Olagunju is an assistant professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University and a psychiatrist at St. Joseph's Healthcare in Hamilton, Canada. He is a member of the advisory board for the Institute of Neurosciences, Mental Health and Addiction, the Canadian Institute of Health Research, and to me, most importantly, an associate editor with the Journal of Climate Change and Health. And Tiffany Christian is a clinical specialist in occupational therapy at Spaulding Rehab Hospital in Boston, Mass, in the outpatient department. She specializes in the areas of spinal cord injury and other neurologic disorders, and she's a frequent guest lecturer at conferences regionally, nationally, and internationally. She is a member of the advisory board of Sustain Our Abilities. So the recordings and more will be available on the website, and there is a link in the chat now. Again, I'm Markley Alexander, the host for today's sessions, and the editor-in-chief of the Journal of Climate Change and Health. And please consider checking out the journal and learning more about what we are doing in the field, also some logistics for today. Please put all your questions for the speakers in the chat, keep your microphones muted, and we're inviting you to keep your cameras on. Thank you, and I'm going to turn it over now to Adesola.
Thank you, Maka, for the introductions. Can you all hear me? Can you hear me?
Yes.
You're good.
Okay, lovely. Yes, and this evening, I don't know, it is evening in Nigeria. I don't know what time of the day is it all over the world, but I just want to welcome you to this session. We're going to be looking at the intersections among climate change, disability, and rehabilitation. When we talk about rehabilitation, it is actually something that is wide. It is a wide concept that is focused on how functional ability is restored or quality of life is improved on for persons with physical impairment, disability, persons with activity limitations or participation restriction. It's actually a very wide concept. So I will be talking about the focus of the day through the lens of a physiotherapist. And basically, I just want to just give you an idea. I know some people could have information on what physiotherapy is all about, but basically it is about providing treatment to restore, to maintain, and make the most of a patient's mobility, function, and well-being. So if I look at what physiotherapy is all about, it's all about movement, it's all about attending to dysfunction, and it's all about attending to issues of painful conditions. So life in itself is all about movement. So when we talk about physiotherapy, we're talking about the movement experts, and we are looking at this intersection of what the physiotherapy can do when we look at the concepts of climate change and persons with disability. Well, based on my experience as a physiotherapist, I have come to manage patients that have both physical disability and functional disability. And one thing that is very paramount in providing management for these individuals with these two types of disability, I know there are so many types of disability, but I just want to talk based on my experience and my interactions and engagement with patients in the clinical setting where I work from. I know that we should always focus on the perspective of where we live. Contextual factors sometimes guide what we provide to our patients. And one of such things that I've considered very, very important, especially when we're managing individuals with physical disability, is the fact that in some treatment rooms, we do not have air conditioning. And if we're going to be talking about sustaining healthcare, and we're talking about physiotherapy, and we want to focus on what is important, that is movement and functioning, it is important that we look at the context of where we treat our patients. And when we look at the issue of climate change, the mortality rate of individuals that do not have that have physical disability is actually about 4 times higher than those without physical disability. I will not bore you about what physical disability and all of this stuff is all about this evening, but I do know that an individual that is physically or functionally disabled will definitely be greatly impacted by climate change. So now, physical activity and climate change. There are so many areas of that physiotherapy is focused on, but based on what we have to talk about today, I want to just focus on the concepts of physical activity. Physical activity basically entails any kind of movement, any kind of activity that involves skeletal muscles, and you have energy being expended. And if you look at what is happening globally, if you're looking at the global physical activity level, we can say that at present, there's a reduction in the physical activity level globally. And when we now look at the concept of climate change, and we look at extremes of cold, we look at extremes of heat, we look at precipitation, and we look at the overall global warming that is a threat to health, definitely these are poised to play a growing influence on physical activities. And then because there has been so much emphasis on climate change and health, climate change and health, but not so much has been done when it comes to looking at the intersections among climate change, physical disability, and the concepts of rehabilitation. And as promoters of physical activity, we need to look at all of this. And again, I want to look at the context. You know, I talked about contextual factors, and that is actually very important. If we look at the international classification of functioning disability and health, the contextual factors are very, very important. There is no way we are going to be able to provide optimal interventions or optimal management for our clients, for our patients, especially those that are at high risk of mortality in reference to climate change. When we talk about physical activity, we want to talk about promoting the health of these individuals living with disability. But Where I live in Nigeria, there are so many uneven surfaces. And when you have uneven surfaces, it does not promote safe physical activity. If we want to engage our patients in expending energy, using their skeletal muscles, riding bicycles, going on their wheelchair, having physical activity, the environment must be enabling. The surfaces must be paved. We do not have such things. Where I come from, the surfaces are not paved, for wheelchair accessibility. And there must be provision of mitigation strategies. We are talking about individuals that are at high risk, individuals that have problems with thermoregulation. That is when you talk about those that have suffered spinal cord injury. And another thing, if we must promote physical activity, with this global threats of climate change, we must have systems that helps to signal its wave warning. There should be public health awareness on the potential negative impacts of climate change in the vulnerable populations of those living with disability. Based on my anecdotal evidence on interactions with some of my colleagues, I find out that some individuals do not even know that physiotherapists have a role to play when we talk about climate change and disability. And in Nigeria, again, there is a low level inclusivity of those living with disability in climate change advocacy and decision making. And most of the time, when you have an individual that has a disability, they're often confined indoors. So how are we going to be able to manage a case where you have extremes of heat, extremes of cold, or when you have a drought, or you have a flood, and then those individuals are confined indoors? They are not allowed to promote their health with the use of physical activity. There is this lack of enabling support. There's lack of access to outdoor environments. And again, even if you live in a place where you're able to have paved surfaces, there are too many uncovered drainage. So what are we talking about this evening? We are saying that for those living with disability, if we must mitigate against the impact of climate change for these individuals, all of these things must be looked into, looking at each context, looking at the context of the developing countries, looking at the context of developed countries. There must be a shift from hospital-based health delivery to an environment-friendly healthcare practice. Because I did say that physiotherapists are promoters of physical activity. Physiotherapists are exercise experts. How are we going to engage those people with disabilities in active movement or in physical activities when we do not have dedicated sidewalks? So there should be a shift. It is not just about having indoor therapy. It is not just about having indoor exercises for our clients as physiotherapists. We should also move away from just indoor, hospital-based health delivery to an environment-friendly healthcare practice where these individuals can enjoy natural light and fresh air in and outside of our clinical environment. And that is just the summary of what I have to say when it comes to the intersection of physiotherapy and climate change and disability. I will be happy to have questions when the time comes. Thank you.
Thank you so much, Adesola. That was a great first start to this wonderful series here, especially looking at the nuances of therapies in Nigeria. And we are going to move now to our next speaker, who is going to be Andrew Olunginju, Dr. Olunginju. Actually, I guess I'm wrong. It's Dr. Pritchett. Tiffany Pritchett is next. Where is it? I'm not seeing Andrew.
It's actually supposed to be Andrew is next.
Okay, here he is. Yes, I'm seeing Andrew now. Okay. Apologies, everyone. Andrew, take it over.
Thank you so much. Can you hear me?
Yes.
Yeah, thank you so much, Bakali. And thank you so much, Adesola, for a wonderful introduction. And I think you've actually helped my presentation because you've defined some of the concepts that are related to disability and rehabilitation. I'm a psychiatrist, and I also have, I'm also working actively, apart from my clinical work, to help support the initiative regarding managing or mitigating the mental health impact of climate change. I have no disclosure. And today, I think I will quickly run through my lecture, giving first a background between the intersection between climate change and health, but with emphasis on mental health. I will also look at what we currently know regarding people with disability, trying to understand how they are currently impacted by the changes we are noticing in climate change. And I will talk briefly, quickly, about what mental health professionals do in supporting rehabilitation of people with disability. As we see, even from the way this panel is constituted, rehabilitation is a team-based care. So a psychiatrist or a mental health professional cannot fix everything, but we work with people like Adesola, Tiffany, and Makili to make sure holistic care is provided. I like this slide, and I like to slide with this slide. And this slide is just to emphasize the reality that in 2020, currently, climate change is not an illusion, it's a reality. And the events that has happened, even in the US, in Pakistan, in South Africa some months ago, has underscored that we have to live with the reality that climate change is here.
Andrew?
Yeah.
Andrew, we're not seeing your slides.
Oh.
Can you make sure to share your screen? Thank you.
Let me share again. Is this share now? Can you see now? Can you see now? Can you see now?
No, we do not see.
Okay, but is it possible for Ellie to, I don't know what is happening. Ellie, is it possible for you to help share the slide?
Can you? Yes, let me pull them up. 1 second.
All right, sorry about that.
No worries.
Done.
Can you see?
Yeah.
Yes,
Okay, excellent. Just tell me next.
So next slide.
next slide.
Next slide. So next slide. So like I said, the reality currently is that climate change is here. Next slide. And as we look at climate change, I like this particular slide. And I currently have this slide in my office. And I use this slide to formulate different ways in which climate change can impact human health. This is a slide prepared by the CDC in 2014, and I use it in patients' education generally. And the goal there is to see that across a lot of disciplines, climate change can have a very wide and broad impact on the life of all of us. But because we are talking about people with disability, these are the different ways in which climate change can impact them, and including mental health. And the interesting thing about this slide is that this slide also underscores the intersectionality and the interconnectedness of all these factors and all these domains of impact of climate change and their relationship to each other. So a person who has migrated because of climate change will be impacted by mental health. The same way, somebody who has had injuries or fatality from climate change will be impacted by mental health. Next slide. And to help us understand the different impact of mental health on climate change, people have provided different framework. This is a very generic framework that underscores the fact that with climate change, mental health is impacted because of the changes in social determinants of health, changes in the ecosystem, complex emergencies, and also people who even have pre-existing mental health condition and disability are also invited or are also impacted because climate change can worsen pre-existing mental health conditions. Next slide, please. Thank you. So more recently, even in our journal, different researchers and studies have actually been looking at how common are mental health reactions and issues that are related to climate change. In fact, Berry in 2010 actually highlighted the fact that climate change can impact mental health in 3 ways. The impact can be direct, the impact can be indirect, and there can be vicarious impact. Vicarious impact in the sense that you are not actually experiencing climate change directly, but because of the things you hear and because of maybe news in the media, you may have some experiences, mental health experiences. And indeed, Stanley and his colleague recently published a paper in the Journal of Climate and Health describing vicarious impact of climate on mental health. And they describe things like eco-anxiety, eco-depression, eco-anger, and eco-distress. These are climate-related mental health reactions. A lot of other studies, including systematic review by Legel and Goodies, more recently, they've talked about how use of substance, mental health disorders, major ones, can either start de novo or exacerbation of existing or pre-existing mental health in the context of climate change. So definitely there is evolving or increasing evidence linking the relationship between changes in climate with mental health issue. Next slide, please. So the question really is, since we are more focused on people with disability, what do we know about people with disability? And Adesola has actually helped us to underscore experiences that are related with people with physical disability. But also she kindly also elaborated functional disability. This definition is a definition I will work with. It's a more broader definition that people with disability are people who have impairment that can be physical, mental, intellectual, or sensory. And this is a United Nations definition of people with disability. Next slide, please. So when we talk about people with disability, the emerging evidence shows us that generally people with disability makes up an estimated 15% of the global population. It's a very significant population, about 1 billion people across the world. And we also do know that almost everyone will experience some form of disability at a point in their life, whether due to impairment in hearing or impairment in sight or even mental disability. A large number of people will go through this. And that's why it is important that we are looking at rehabilitation work, and now we can improve what we do for them. Much more importantly, with climate change, the experiences of people with disability are intense and much more severely, just in line with what Adesola has underscored. And all these facts that I've listed there are facts that are well written in the Article 25 that was published by the United Nations. Next slide, please. And more recently, research, including one that was done by CRE in 2020, underscored the fact that mental health distress is higher, about 5 times higher in adults. The same findings have been found in children with disability compared to people who are normal adult population, which again underscore why we need to look at the care as climate change evolve, more especially. Next slide. And given all this evidence, the question really is, we've underscored the fact that mental health has a relationship with climate change. The question really is, what is the role of mental health professional? I want to talk about mental health professional. I'm not just talking about psychiatrists. I'm talking about a team, social worker, mental health nurses, clinical psychologists, social recreational therapists, a whole lot of teams generally. What is our role? And I will show in the next slide. I will show in the next slide a general framework for psychiatric rehabilitation or rehabilitation work in mental health. Like I said, mental health rehabilitation in people with disability follows a framework that we allow a team to help improve or empower people who have disability. We include their family. Family must be integrated. Also, there must be promotion of connection, and it must be focused on existing strength. And then communication, very, very key. I like this particular framework that was designed by Chatham Mental Health Behavioral Health for developing rehabilitation program. I'm not just talking about the acute intervention, psychology intervention that are related to complex emergencies. I'm talking about long-term programs that are developed to make sure people with disability are well adapted, well taken care of, and can function optimally and can enjoy quality of life in spite of the increasing changes in the climate. Next slide, please. And for me, for all of us here, and for people in mental health, I have these few suggestions in terms of how we can engage actively in the work that our colleagues are doing. Like I said, we work as a team. I think every mental health professional should, or everybody working with people with ability should be cognizant of the need to conduct a comprehensive assessment and holistic assessment. Rehabilitation work among people with disability, as we look at the impact of climate change, we continue to need more teamwork. We need to listen to them. And more importantly, we should not do anything for them without them. And then I think ethnocultural sensitivity, very important. Adesola actually underscore the importance of contextual factors. Cultural factors are part and parcel of who we are and the context where we live. And I think it is important that we validate their experiences and avoid tokenism. Next slide, please. I think, and I will stop here because I look forward to to questions and answers. I think beyond what I've described, the other pertinent question that I want us to go away with is, what can I do, or what am I doing as an individual to improve or to support climate change action? And if you have time, I will highly recommend that you visit this United Nations website link that listed 10 simple actions that we can do beyond our professional responsibility to make sure we support the current action to mitigate the impact of climate change. If all of us work together to mitigate the impact of climate change, the increased adverse impact of climate change will be reduced on people with disability. A few of them that I will list here is the promotion of green environment, using of alternative energy that will promote low carbon emission, and then lastly, making sure that we manage waste appropriately. Next slide, please. And lastly, I want to drop this with you. I know some of us may be researchers or may be doing projects. I think the other thing we can also do is advocacy and dissemination of information through publication and writing. And if you have any work, this particular journal will be a good place for you to publish your work. Thank you very much. Next slide. So I will hope that Tiffany will take over from here. Thank you so much.
Thank you, Dr. Alonganju. And thank you, Tiffany. Just a reminder, if anyone has questions, please put them in the chat because we will do a Q&A at the end. Thanks.
All right. Thank you, Andrew, and thank you, Mark-Elise, so much. I'm so happy to be here today and presenting. Like Mark-Elise said, I'm an occupational therapist at Spalding Rehab Hospital in Boston, and also a member of the advisory board on Sustain Our Abilities. And I don't have anything to disclose today as well. And the opinions and point of views that I'm expressing in this presentation represent my view and does not necessarily represent the view or the position of Spalding. So what is occupational therapy? We're a science-driven, evidence-based profession. We base our evaluation, our treatment on research and gold standard of best practice for the individuals we see with varying disabilities and injuries. We enable and assist people of all ages to participate and engage in daily living or live better with injury, illness, or disability. And we accomplish this through designing strategies for everyday living and customizing environments to develop and maximize their potential. And we do this by taking in the whole picture, just like Andrew was talking about. We look at their psychological, their physical, their emotional, social and cultural makeup. We assist people in achieving their goals and functioning at the highest possible level, concentrating really on what matters most to them, helping them maintain or rebuild their independence through activity modification, remediation of impairments, use of adaptive equipment. And we really want to help them participate in the everyday activities that they need to do or that simply make their life worth living. Occupational therapists and OT assistants are experts in helping people perform the occupations, which are what we call meaningful activities they want to do every day. So how is climate changing impacting these meaningful occupations? Climate change is one of the major challenges impacting quality of life and the mental, physical, social, spiritual, and economic well-being, not just of individuals, but groups and populations on a global level. We're seeing an unprecedented number of global climate refugees due to environmental degradation, which is leading to forced migration, civil conflict, losses of jobs and income for individuals. There are food insecurities that are leading to malnutrition and disease, which once again are leading to forced migration to other countries. There are severe weather events, which are causing injuries, fatalities, further disabilities, loss of homes, and a huge mental health impact, as Andrew was just talking about, on individuals with and without disabilities. And poverty and wealth inequalities are just becoming more exacerbated by existing social health that are just exacerbating current social and health vulnerabilities, which just leads to an enormous occupational injustice. So as a profession, we affirm that human-driven climate change threatens not only our life-sustaining ecology, but also meaningful and culturally relevant occupational participation, mental and physical health and well-being locally and globally of individuals. And we have, as a profession, an ethical responsibility to support our clients, whether those are individuals, groups, or populations, to sustain environments and the ecosystem in order to foster a more occupational justice. So how does sustainability and occupational therapy work together? It can be best understood as the ability to choose and participate in healthy, meaningful occupations or activities without threatening the availability of resources to enable other people to participate in their own meaningful occupations in the present as well as in the future. And it's also the ability of future generations to pursue similar occupations. And so we really want to look at how we promote the exploration of how individuals and groups and populations daily occupational choices or activity choices encourage the use of resources in an environmentally ethical manner. So when we think about these things, we want to think about occupational choices or activity choices, and we want to consider the sustainability of those when we're doing activity analysis with our patients and our clients. And we want to encourage environmentally friendly choices in everyday activities and occupations, including not just those of our clients and patients, but personally and professionally within our practices when possible. We want to try to promote changes in our clients' habits and routines, working with our clients to consider how their habits, routines, and patterns can mitigate the effects of climate change, such as recycling or reusing resources within their home, promoting alternatives to disposable consumerism, and assisting those most affected by climate change through adaptation strategies and evidence-based interventions utilizing nature. We want to consider guiding clients into occupations and activities that are still meaningful to them, but don't involve consumption. We also need to think about how to assist clients and communities who are displaced due to natural disasters, or those who are experiencing occupational disruption related to climate change, like individuals in Adesola's home country of Nigeria, who due to lack of rainfall and droughts aren't able to farm food for themselves or as a source of income and are leaving their country to go to other areas. Or assisting our clients and individuals who, like in South Florida, most recently, Ian injured several thousands of people and destroyed homes, which then impacts people's abilities to participate in these meaningful occupations, whether it's their jobs that they hold or using transportation and public transportation, or their roles as mothers, wives, husbands, children, students are being changed. And so all these things are things that we need to consider, especially with our climate refugees who are displaced or really experiencing these occupational disruptions, because we want to help try to prepare them before these actions happen or these events happen. But we also want to try to help them adapt to it and recover. So putting it into practice. So what does this look like? Well, one of the ways it looks like is the co-benefits of sustainable lifestyles in health and wellness. There are occupational therapists in the UK through Thrive organization who are currently putting together gardening projects, and they're helping individuals and people figure out how to use urban spaces or allotments for food production. So these could be leisure activities or possible new vocational opportunities for people. And by doing this, they're learning how to grow their own food. And by growing their own food, these individuals can reduce the demand for food products from shops, thus reducing pressure on environmentally harmful transportation of the food through supply chains, and then proactively are making healthy, fresh foods available, thus improving diet, health. People are getting outside, they're more physically active. All those things help with physical improvement as well as mental health improvement. Occupational therapists, practitioners can also work with community organizations as partners to help people learn how to repair domestic appliances rather than replacing them with new ones in order to reduce consumption. And this can be within their own homes, or it can be possible new vocational studies or options for individuals who have sustained disabilities and maybe aren't able to go back to what they were doing for work prior to their injuries. And lastly, We can always educate in several ways, but one that I do with my clients with spinal cord injuries is on options for catheters to promote less plastic use while still promoting independence with bladder management. And this can be catheters without bags that have less plastic, or reusable catheters, or catheter bags that are made of latex that allow for reusability and washing. So these are just a couple ways that we can put things into practice. And occupational therapy practitioners have always realized the significance of the environmental context for human occupational performance and good health. But now we really need to be more inclusive of ecosystems as part of this individual's context. So lastly, I just want to conclude with that sustainability is really about human empowerment. And Andrew talked about this earlier. Empowerment so that individuals are agents who affect their own health through reflective occupational participation, to support a healthy environment in which they currently exist for themselves and for future individuals. We want to continue to explore the social, economic, environmental, and spiritual determinants of health as part of a preventative healthcare approach. We want to look at how we can change the climate now to improve our health later. And like I said, empowering and enabling individuals to take control of their own well-being and their impact on communities locally and globally. We want to work on eliminating wasteful activity and making use of low carbon alternatives. And like Andrew talked about earlier, some of these things are simple changes like reducing water waste of shorter showers or using rain barrels, turning off water when we're doing the dishes or brushing our teeth, not leaving electronic devices plugged in after their charge, and turning off lights when we're not using them, or using LED lighting, recycling or reusing durable medical equipment and adaptive equipment that can be given to someone else instead of put out in the trash, switching to renewables, or insulating your home, or buying energy efficient appliances, and even just changing our eating habits for a more plant-based diet can also help decrease our carbon footprint and also improve our health and wellness. Lastly, we really, and I as an occupational therapist, want to assist individuals with a wide variety of disabilities and vulnerabilities, not only be prepared for climate-related emergencies and disasters, but live their best lives as independently as possible and empower them to know that they can make a difference. So thank you.
Thank you, Tiffany. Thank you, Tiffany. And what I want to say thanks to all our presenters and just pitch in here. What we're going to do now is we're going to transition to our case studies, and Tiffany is going to read the case studies. And then what we're going to do is put the team together in terms of talking about how these cases might be addressed. And I also want, as I'm watching, I'm realizing here that we have we've learned from occupational therapists, physical therapy, mental health, and psychiatry. We certainly have our colleagues, also the psychologists, and we also have our nurses that work with us in rehabilitation. And one of the things we've talked about is teamwork, and I just want to emphasize this as we transition into the questions. Also, rehabilitation physicians or physical medicine and rehabilitation specialists are part of the team, and that's what I am. We've also got recreational therapists that get involved, respiratory therapists, but most importantly, when we talk about rehabilitation, the leader of the team really is the person living with disability. And I think we've emphasized that a lot in this in these discussions here, and the importance of a holistic approach and interactions with the environment. So I just wanted to comment on that as an observation after hearing everyone's presentation. And Tiffany, I'll turn it back over to you so you can go through the cases and we'll all pitch in. Also, a reminder to people in the audience, please, please, if you have questions for the end, in probably about 15, 20, 30 minutes, please put your questions in the chat. All right.
All right, thank you, Marco-Lee. So the first case we're going to do is a gentleman named Vergasto. And Vergasto is a 40-year-old man who currently lives in Ghana, who was injured in 2021 when he was struck by a car while selling food at a roadside stand. He was diagnosed with a C6 Asia A tetraplegia and utilizes a manual wheelchair in his home and community. He lives with his wife, 3 children, cousin, and mother in a 2-room compound house. His family assists him with self-care needs like bathing, dressing, and mobility in the community due to uneven and rocky grounds. His home currently does not have indoor plumbing. Vergasto travels an hour to a clinic for physical therapy where there is no rehabilitation physicians present. And drought and reduced rain this season have inhibited the country's hydropower systems, resulting in frequent power outages. And when he arrives to his appointment at the clinic for his physiotherapy, power outages have left the clinic without air conditioning. And due to his inability to regulate his body temperature, he begins to become dysreflexive. So he's unable to tolerate physical therapy in the building. The session was then completed outside with limited resources, an inaccessible bathroom, and piles of local garbage surrounding the building. So
Who wants to
Adesola,
start?
yeah, Adesola, would you like to start for us?
Thank you. Yes, I was just thinking, looking at this case study, when we want to manage our patients, it's not just a function of just pitying them, it's not a function of just showing sympathy. It's not just about empathy too, but it's more of compassion. So I was just sitting down while Tiffany was reading out the case study, and I was just imagining that if a case like Vergasto, how would we, in the case of a tornado or a flood, we do not have tornadoes in the African setting. Let's say in the case of a drought, of a flood, how exactly are we going to help Vergasto to be integrated very well into the community where he lives? Because basically community mobility is very, very important. It's something that is important to Vergasto. Vergasto has to move from one place to the other with his wheelchair, even though he's very much dependent on his relative to help him move around. So the context of environmental factors and personal factors also come to fore here for Vergasto. As a physiotherapist, for instance, if Vergasto has to move from where he lives in the community for an indoor physiotherapy session, for instance, how do we think Vergasto will be able to navigate through the terrains? The terrains, we have the issue of power outages. There are so many things about Vergasto that I would want us to look at. The issue of drought and reduced rain, all of these in itself, as I'm translated into frequent power outages. Vergasto is tetraplegic. Vergasto has problem in regulating his body temperature. So if Vergasto has gone through all of the limitations of getting to the clinic, the issue of, look at the picture that Tiffany showed us in the previous slide, looking at the uncovered drainage, looking at the gutters all over the place. And, because Vergasto is very determined, Vergasto knows that physiotherapy has a role to play in his quality of life, in maximizing functioning. He gets himself by all means with the help of the carer. Sometimes family, they could even have informal caregivers, but in this case, family assists with self-care tasks and community mobility. So this family is also burdened in the care of Vergasto. With all of this burden, Vergasto has an expectation. The expectation of Vergasto is, when I get to the physiotherapy department today, I'm going to be given therapy. This therapy that is centered on my own outcome. Excuse me. And Vergasto gets to the clinic, and unfortunately, excuse me, Unfortunately, by the time it is now Vagasto's turn to be managed, there is power outage. Vagasto is sweating profusely. Vagasto has to be exercised, arm exercises on the wheelchair. All of these are contexts that we should look at, even with the issue of climate change. Even when we decide that we're going to have outdoor environments and kind of therapy, what are the considerations? There's so many enormity, when we talk about the enormous challenges that Vagasto has to deal with. Thank you.
Thanks. Can I go next, Tiffany? I just wanted to make some comments. I want to kind of bring some of the words out that were in the case study, because I realize that not everyone might be a rehabilitation professional. And I tend to kind of be real plain in the way I speak. So Vagasto has a spinal cord injury, and that's what tetraplegia is. And it is, the term ASIA means that he's totally paralyzed in his legs, and at least part of his arms are totally paralyzed. So we're talking about somebody here that can't lift his legs, can't walk, and he has to teach other people really how to help him. So I think that's another really important issue here, is that if we look at Vagasto, he really is the leader. He's living with this spinal cord injury in this environment. And he also it's important that he knows, as Tiffany was saying, about some of the issues that can impact his body. For instance, we talked about with the temperature going up, his body, the term dysreflexia that came up is an abnormal reflex that people living with spinal cord injuries can experience. So what we're talking about here is how, not just how the team members need to help, but how Vagasto needs to be enabled to speak up in the community, to speak up to the rehab team, and to take control over what's going on in his body and with his family, with climate change. Because the reality is, Vagasto, there's many Vagastos. And one just comment I would make is that when we think about the concept of disability and climate change, it's also really important that we realize that people living with different disabilities have different impacts. And so some people may have pain, others may be totally paralyzed, others may not be able to see or hear. And that's why it's really important that people in rehabilitation speak up as a profession and work with people with disabilities as climate change and health becomes more and more noticed around the world. Thanks. Andrew, love to hear your comments. And we'll pass back to Tiffany for case 2.
Yeah, for me, I think this case is very interesting. Aside from Vagasto suffering from physical impairment, even the environment, he said the trash is near him, can impact his self-esteem. And not just that, the family member and the community members, they might be experiencing different distress. So it might be something that as we work with Vagasto, caregiver burden may become an issue. I just want to highlight that because I know we still have other cases, but this is a very interesting case that shows the very multifaceted ramification that can impact physical issues, mental health issues, psychological issues, not just for the patient, but even people around the patient as a whole.
I agree with you, Andrew. One of the things when I looked at this, and I'm reading this case as well too, is really taking in like the social and cultural aspects as well, and the impact of disability in this setting and in Ghana, and the perception of individuals with disabilities, but also, Vagasto's losing his role within his family. If he was the primary supporter and income supporter, and losing that, and also how that can impact one's self-esteem and feelings of oneself and lead to depression and things along those lines as well. I also think, as therapists, being flexible in our thinking, because most of the time when we're working with individuals, things don't always go the way that we plan or how we'd like it to go. So I think the flexibility of thinking how we can meet their needs in uncertain circumstances, like him not being able to be inside where there probably are more resources for him to do exercises or weights or therapy, and really using the environment outside to still address his needs and function. So, but we do actually have some polling questions for our audience.
And I'll read the question here. Would telehealth be a better option for Vergasto? Yes or no? Please all answer. Very interesting answers here. I think I'm going to end the poll here now. 70% said yes, 30% said no. And I would just 69% yes. Rosanita has a good question here. Does he have access to the resources? And that's an important question. Knowing Adesola and Dr. Odell, I know she's a strong proponent of telehealth, and I do think that it is a good option in many low resource environments. But certainly there are limitations, and he needs to be having telehealth with someone that could help him greatly.
Yeah.
Is there another question?
I actually think regarding telehealth too, like from a therapy perspective, sometimes therapists can be afraid to use telehealth because they don't feel like they're going to be able to help their patient or client the way they really want to be able to. And like you said earlier, Markley, about just really educating Vergasto on his body, his injury, things that he is going to be experiencing because of climate change and because of his injury. Telehealth is a wonderful opportunity to address those things, not only with him, but also with his family. And I think telehealth is also, if he has the accessibility to it, is a wonderful way to really see into our clients' homes in their true setting that we don't always get a great picture of when they're coming into the clinic. So I just wanted to share that as well with my experience with telehealth.
I think I just would also make a comment in that, especially in the case of persons with spinal cord injury, it can be a good option because persons with spinal cord injuries have even worse mobility than many other people living, that are elderly or have other disabilities. So while telehealth can be, it's used often for mental health these days, oftentimes the people that are getting telehealth could be walking to therapy or walking to the doctor's appointment, where in this case the person couldn't.
Yeah. And we have,
I think we need to go to the next case soon.
Oh, okay.
We can do this. We're just good. We just have to be quick. All right. What would be considerations for outdoor PT instead of indoor in this setting where the power supply is erratic? A, pressure relief education. B, modify the rims on the wheelchair to allow for better grip. C, therapeutic exercise in the wheelchair, or D, all of the above. And if you want to give your answers, we're not seeing the poll answers now for some reason. We'll move on to the next.
We can see them.
You can see them, okay.
Markley.
Oh, okay, great. All right. So the vast preponderance of people are saying all of the above, which I think sounds reasonable.
Yeah, excellent. All right, and we'll move on to the next case. And this is about Mike. In 2008, a rare storm, excuse me, buried Portland, Oregon, under more than a foot of snow. The city was gridlocked and Mike was stuck in his home for 8 days. Mike had been diagnosed in 2007 with multiple sclerosis. He currently uses a power wheelchair for mobility in his home and community, but requires significant physical assistance with transfers in and out of bed with the use of a slide board. He is highly reliant on caregivers and personal care assistants for his self-care tasks, which include setting up adaptive equipment so he can feed himself, getting dressed, and using the bathroom. He recently has begun participating in an intermittent catheterization program as he has been unable to fully empty his bladder, causing several urinary tract infections with associated hospitalizations. Mike currently does not drive in the community and therefore uses his power wheelchair to travel 30 minutes from his home to a local pharmacy to obtain his needed medications. So I can start first. So from an OT perspective, I think one of the things that we really need to think about, and I know this was a rare storm because Portland, Oregon, which is on our west coast, typically does not get this much snow. But in cases in areas that are hit or are more prone to emergency weather instances, I think really talking to our patients and being preventative, like how are you going to prepare for emergency situations and what does that look like? It looks like having extra water and maybe a week's worth of medication on hand. If we know a storm is coming, you know, talking to our PCAs, our personal care assistants, or our families and caregivers to see if there's someone who's willing to stay over with them. Talking to, in the US, to emergency individuals like police and the fire department to let them know that I am an individual with a disability that requires significant physical assistance. So if something happens, I'm going to need a lot of help. I had one patient that I was working with yesterday that said he's already notified his local authorities and they actually have a key to his apartment. So if something were to happen, they'd be able to have easy access into his home. Even things like making sure that he has an extra battery pack for his wheelchair and things along those lines, so that if and when this situation occurs, and they're occurring more and more because of our climate change, that people are better prepared. There are concerns though for someone like Mike who would be in bed for eight days and isn't able to maybe change position like independently, and worrying about pressure ulcers and wounds that can lead to bigger injuries and hospitalizations. So individuals like Mike are very vulnerable in situations where there are significant weather issues that leave him set up for definitely larger health issues.
I would just, Andrew.
Yeah, and I think some of the issues highlighted by Tiffany are very important to ensure Mike continues to enjoy good mental well-being. We do know, for instance, when people have urinary retention, they can develop infection, and sometimes they can develop what we call delirium, where there is alteration in the way they function mentally. So all those simple things really that we can do, making sure the catheter is working and ensuring that they have health education, very important. I think one other important thing that I also want to echo again that Tiffany has mentioned is identifying strengths. The caregiver is available, what they've been doing before, to make sure we use what is available, the strength and the resources available, to make sure they are well adapted for a major climate event. This has proven to be very, very important in the long term. I kind of also love the way Tiffany put it, that resources can differ from context to context. So we need to take that into consideration.
Okay.
I would also comment that if I can point out, this case amplifies the issue of climate change versus global warming. People that live up at the circumpolar regions are impacted differently than people that live at equatorial regions. And many indigenous peoples may also have disabilities. And so you can be in an environment where you're used to being able to push your wheelchair on ice, but the ice isn't there anymore. And that is a new source of a problem. And so what we do need to realize is that, I think, as Andrew was saying, we need to learn from strengths, and also we need to listen to the strengths of the person that's living with this particular issue. One of the things I learned from one of my patients at one point of time was, as he got out of his wheelchair van, he would drop his cell phone sometimes. And then he realized that he was stuck without his cell phone. And his personal solution was getting a watch, or like an Apple Watch. And I'm not doing a commercial here. But as a provider and someone that works in the space of climate change and the way the world needs to evolve to become greener and healthier, and thinking about adaptation and mitigation, perhaps it should be given in any country that persons with disabilities have access to cell phone coverage, and in the form of something that's on their bodies, should they choose, because this will enable people to get other forms of assistance that they may need.
Can I just say something? For me, I will be so much interested in how we're going to reduce the impacts of MS, of multiple sclerosis, on his level of disability. And because we know that this is something that is long-term, it is something that goes into chronicity, the collaborative care, for Mike, even if we're going to adapt or integrate the use of telehealth, we would want to do something that involves every discipline. The neurologist is involved, the OT is involved, the speech therapist is involved, the physical therapist is involved, the psychiatrist, the clinical psychologist. So that is really, really very important, because looking at all of the symptoms of what Mike presents with, and with the double burden of the winter storm, I'm sure that it's not just a case that is going to be managed by one discipline. It is something that we should all look into, and possibly even integrate telehealth.
All right, so we can move on to our poll questions for this case study.
And we'll just read them quickly. Have an extra battery charge, have extra medications, have a plan in advance, and all of the above. And I'm going to end the poll in interest of time. And I think that people can see that there are a lot of actions that he can take, and the goal is to be proactive.
Excellent. And then our next question is,
what areas should we consider with an emergency assessment tool to assess disability? It looks like everyone's listening. The majority has indicated all of the above. And really, we've got to look at the whole of the person's environment and being and family. All right, let's go on to case 3.
all right, case 3 is Ona, and his family live in Porta Cana, a small town on Canada's East Coast. He is a 6-year-old boy diagnosed with autism spectrum disorder, and he now spends more time with his paternal grandparents who live a few buildings away and take him for routine appointments in a local clinic and a regional hospital, which is several kilometers from their town, for special appointments with therapists. Their town was known for its beautiful coastal water and seafood until it was impacted by Hurricane Staka last year. Ona's family were severely affected by the hurricane. Their small family business and home were destroyed, and they lost some of their close friends. Following the hurricane, Ona was noticed to show a major change in behavior characterized by increased anger bursts, becoming more upset when there is a weather alert, fidgety, and having difficulty sleeping, as well as numbness. His appointments were rescheduled last month due to inclement weather and the recent health challenges experienced by his grandfather. More recently, there was a National Weather Service alert on the TV and radio regarding a Category 3 hurricane. His family are concerned and wonder for answers about the changes in Ona's behavior and the lack of progress observed in his speech therapy since the last hurricane. His grandparents are worried about the increasing number of weather alerts and wish they could do something about this.
Thank you so much, Tiffany. Maybe I give it a start, and I hope we can also provide perspective. I think this case illustrates the fact that no matter where we live, whether in a small town or city, the impact of climate change is global. And then importantly as well, climate change impact is cuts across the different age groups. So Ona is a young child, has autism spectrum disorder, but it looks as if with the past hurricane, one, his routine appointment has been canceled. And although people with autism spectrum disorder may have issues with communication, he seems to be able to, in a way, link recent weather events with past severe impact of the past hurricane on the family. Also very interesting or very conspicuous in this case is that sometimes when there is impact of climate change, people's social role may even change. So now he spends more time with the grandparent because the parents are trying to build their new businesses. So the impact of climate change are subtle. It can be physical, it can be emotional, it can even involve changes in role. And then more importantly as well, I think Ona seems to be experiencing, if we want to look at it from the perspective of mental health, all these changes in his behavior, anger, burst, numbness are signs and symptoms of post-traumatic stress disorder. The important thing about this is that the emotional, physical, and other impact of climate change can be immediate and even can last months and years, because usually post-traumatic stress disorder are the long-term complication. There can be initial acute stress reaction, but post-traumatic stress disorder are usually a more longer-term emotional complication. And then also in this case, given all that is happening, Ona's grandfather is actually looking for what to do. Although I'm a psychiatrist, sometimes when people come and we are talking about issues, I look for opportunity to do public health education about the impact of climate change. I think Ona grandfather presents an opportunity. Let's say it comes to the clinic and he's talking, I'm worried about this. It may be an opportunity for us as health professionals to empower them about the current changes in the climate and the possible complication. I think I will stop there, but that case, those are some of the highlights that I want to talk about.
I think, like, when I read this case, thank you, Andrew, I also think about, Ona and how he may have kind of lost his role as a child and the things he was participating in before the hurricanes or before he lost his home and is feeling displaced, possibly lost, and just trying to help him re-engage in some of those activities, which for a 6-year-old is really about play, and maybe, becoming a student, and really helping to re-engage him in some of the things that he finds meaningful and activities that he enjoys, just so he can have a sense of just comfort and belonging and normalcy following such a significant disaster to his home and to his area and disruption. Once again, we were talking about occupational disruption, and this is what happened here for him. So I think that's another area that we could think about, ways to help him engage, to feel like things are maybe starting to move back to pre-hurricane.
Yes, let me say something from the physical therapist's point of view. If I have a case like Honor come to my clinic, I'm definitely not going to treat him like the usual patients that has autism. I would want to direct my therapy to psychologically informed physiotherapy practice. And in this case, again, I would also want to encourage the development of tools or outcome measures that would assess psychological attributes in children like Honor. So it will be something that will be contextualized, because I know that if we have this kind of a case in the place where I live, tools that have been developed in some different locations will not be too ideal. So I would want to lay emphasis on the development of contextualized outcome measures for children with psychosocial attributes like Honor, and even have such tools for their caregivers, because if Honor's grandparents are also not involved in the total therapy, in the total rehabilitation, it could even impact on Honor's treatment outcomes. Thank you.
I just sat and was fascinated by this discussion of this case, because I just think this is so important. And I think this is so much more of what we can predict in our future. The issue of PTSD, about climate change, about other issues going on in our societies around the world, is just growing and growing. And next week we will hear from Gretel Dillon, Dr. Dillon, who is actually just experienced her second full hurricane and was still without power and having to drink water from her swimming pool last week. She's in Ponce, Puerto Rico. So this issue, I think of as I talk to people, as I talk to friends, even having experienced hurricanes myself, is, so much of things become that fear, that automatic fear that triggers in a person, and understanding how this impacts, a child, especially a child with living with autism, is an issue. And I just think it's so important, and it emphasizes how we need to start educating children in schools. Kids need to learn about climate change and disaster. It's part of education. We've got to figure this out. It needs to be like, health education, climate education, and it needs to not be a political issue, but a human health issue for everyone. And I just wanted to say that also, I think the issue that you mentioned about getting people engaged is important, because sometimes when you deal with depression, you deal with psychological issues, PTSD, being engaged and active is a beneficial treatment. Is that right, Dr. Olonginju?
Absolutely, very important. Yeah.
And the other concept I saw here was the intergenerational concept. I think solutions need to be intergenerational. Those of us that are older need to work with the youngest of us to find solutions, but empower the youth to take over, but help on our way out, right? We've got to be intergenerational. So I just think it's such an important case. I think we have to turn over quickly to the questions, but we'll do these polls quickly.
Oh, okay. Sorry.
That's all right. I'm going to take over. We're going to, and I want to apologize because I didn't mention speech therapy before, but that is certainly a big component of the rehabilitation team. And again, all of the above.
Yeah.
All right, so I'm going to move over now to the workshop questions. And is there a way to get rid of that poll? Are we still, does everyone? All right. All right. Sorry about that. So we have a question here, and we're going to take this first question that was in the chat, and it is, how can we motivate our fellow therapists, doctors, and people living with the experience of disabilities to understand and act and take action on climate change? And maybe we'll start with A's, and Andrew, you go first, then Adesola, Tiffany, and we'd love to hear some comments.
I think we cannot overemphasize the need for global engagement. And the way I think about it is, we do not just have to do the talk, but we live or walk the talk. We live by example. I find it much more easy to talk to people when I can share my own personal experiences, what I currently do. I'm a psychiatrist, but I work in a journal. I belong to a professional organization. I'm a member of the Committee on Climate Change with the American Psychiatry Association. I go to the community to do public health education. So I find it, people believe me more when I can tell my story. When people see that you are doing it. So I think beyond just talking, we also have to be doing things so that we can lead by example. But other than that, simple action. If you want to talk to somebody to do or to live a more green life, the question is, what are you doing yourself? So I think we need to lead the talk. I think I'll just stop there because I want to allow other people to also talk.
Okay.
Thank you.
Thank you. Yes, I think the most important thing is, since we're talking about how do we engage professionals, healthcare professionals, in this advocacy for climate change, I think the most important thing is to put the patients or the clients at the center of our care. By the time a professional knows that there's a thin line between being a health professional and the patients. So if you think that because you are the healthcare professional today and you don't seem to integrate what matters most to the patient, and you are thinking that, oh, climate change does not necessarily have so much impact on the patients, even though climate change affects everybody. It affects all lives. But when we bring it down to those with physical disability, we need to tell ourselves that we need to move out of our comfort zone. For instance, next week we'll be having a conference, and I decided to talk, even though the theme of the conference is not about climate change, it's not about advocacy about climate change and disability, I requested for 10 minutes during the conference to be able to talk about this issue that most healthcare professionals are not even aware of. So when we are in our clinics, wherever we are, we can start up a conversation to create awareness about climate change. And of course, the journal too is another avenue. We tell them, we share research outputs, research findings, and let them know that climate change affects everyone, and it could affect them even as healthcare professionals. Thank you.
Thank you.
Yeah, I agree with Andrew and Adesola that we need to lead by example. I think for our clients, for our colleagues, for our patients. And I think the biggest thing is letting people know that even if they aren't feeling big effects here where we are, that there are big effects in other places, and that what we do here, even though people may feel like it doesn't matter, it does matter, because what I do here impacts my friend Adesola in Nigeria, and I want to make a better life for her. So I think also showing people that it doesn't have to be these big changes, that small changes can have such a big impact. So I think those are some of the ways. And I think for like my colleagues is really showing them that direct connection between climate change and health in individuals with disabilities and without disabilities, and really showing that tie together, you know, through research, through demonstrations, through things like what we're doing here today, so that they can really see that there is this connection.
Thank you. I'm going to not answer this question, but go to the next one. And I'm going to go first with the answer. And it's, how can we ensure people with disabilities and other groups of people that are especially vulnerable to climate change, such as Indigenous peoples, work together in solidarity against climate change? And I would say, I just want to explain to everyone the title of this seminar. And it was, part of it said it was a Day for Tomorrow workshop. And many of you may not know what Day for Tomorrow stands for. And it's a concept that Sustainabilities has had, where we have a parallel to Earth Day, where people all come together in community. Because community really is a big part of the solution to climate change. And so we ensure people come together in community. I'd love to hear your input on this and how to make sure people are in solidarity instead of being in silos. Andrew, you want to go first again?
Yeah, I think this is very, very important. A recent document released by United Nations actually talked about the need to actively involve people who have disability in order we discuss as much as possible. There is a general, and I think I mentioned it in my slide, there is a general slogan for public health, which people, even in climate change action, have been talking about, that there should be nothing for us without us. Everything we do should take into consideration the voice of people who are vulnerable, the Indigenous people. We need to be culturally sensitive, and we need to be inclusive. I think if we're going to go far, and we are going to develop solutions that will be far-reaching and also deliver the outcome that we need, community engagement has to be a priority in all that we do.
Thank you.
Yeah, I agree with you. Oh, I'm sorry. Go ahead, Edisola.
Joseph, there's a hand up. I think Joseph, somebody in the audience has just raised his hand.
I'm just trying to get to the questions. We're running out of time here. So
you can go to the next question if you like.
Hello, are you allowing me to say something? Can I speak?
Yes, briefly, yes.
Yeah, as someone with disability, I had polio when I was young, and I'm 64 now. I've also been an activist on many fronts: culture, disability, and environment. I could say that in terms of climate change, I posted the last public activity I did. I was a guest on the national radio and television with a former minister of St. Lucia, trying to make the keys for climate change to be integrated in all what we do. But I could tell you, as far as my country is concerned, even as the new government tried to be inclusive, little mention was made in the framework for the budget, the new budget framework, and we had to point out that people with disability matter. So the idea of discussing people with disability in relation to climate is a little way distant to most of the Caribbean islands. So it's good that we've started the process, and I would like to stay in touch with as many people as possible that we could help to broaden build consensus.
Thank you, Joseph. We're gonna, I don't mean to cut you off, but we're gonna run out of time. I'm not sure if we have a hard stop here. We will, we can keep on going, but I want to be respectful of the fact that it's, we're going to be at the 90 minutes. So I think what we need to do is see if any of the participants have any final words, and then Haley, are we allowed to continue, or we can continue for a little bit? But I
Yeah,
understand if people need to
we can
talk.
stand for a couple more minutes.
So am I still able to talk? Or should I not?
I think we
I'll
should let
just,
the
No, I'll just wrap up. I was just saying that if the people here, present here, can find a way of staying in touch so that we can help each other, supporting the work that we do in our various region or various countries or so, I will be most helpful. Thank you. I'll be most thankful, sorry. Thank you.
And I wanted to tell everyone that next week we are going to have the full session with participants of people living with disabilities in different environments. And we do want people to get involved and work together as a team. And this is just an effort to start engaging and educating healthcare professionals, but people with disabilities really need to be interested and empowered, and we need to work as a team.
Do you want to ask one or two more questions, Marka, and then before signing off?
I think we can do one more question we have time for, and this is, how can we start working on mitigation in the field of rehabilitation? For instance, the area like catheters, how can we change our model to where as healthcare we're actually thinking about these things?
That's a really good question. It is a very, very, very good question. And I really think, at least from my perspective, it comes from educating healthcare providers what other options for catheters or equipment is out there. I feel like sometimes what we know can be very limited until we look outside of our box. So I think one of the first things we really need to do is educate other healthcare providers that we're working for. I know, like in my setting, I'm primarily the one that works on bladder management with individuals, but there will come a day that I'm not going to be here. And so I need to make sure that I'm disseminating education on this very important thing. And through that, saying, here are options that help with sustainability, that decrease our carbon footprints, that use less plastic, and that these work just as well as the others, and let's try to talk about and have these conversations with our clients and our patients so that they know that there are other options, because what I find is that they just don't know about other options. And so it's our ethical responsibility to provide those for people. And I think at like an institutional level, just really having open conversations about what am I doing personally to decrease my footprint, and what can we do as an institution to decrease our footprint, and having people that are willing to have those conversations and kind of push the envelope and say, hey, we can't forget about this because we're big here. Our network, our MGB network, is enormous in New England and the Massachusetts area, and we can have a big impact on the environment if we change just a few things. So I really think it starts with conversations and education.
And to follow up, Tiffany, thank you so much. I think to empower our conversation and engagement, I like data. I have background in epidemiology. We need to collect data as well, disseminate the data. I know some hospitals here in Canada and also as well in the US, they currently are looking at how they can collect data on the level of carbon emission that hospitals are actually, hospitals are generating. I think sometimes I find it very powerful when I talk to people and I can give them data to talk about. So I think to follow up with what Tiffany has said, data collection and using it to empower our discussion, also very important.
Yeah, you're right, Andrew. Showing the research, because the research doesn't lie, and having that to show people is really important. That's a very good point. Thank you for sharing that.
Yes,
so any comments, final?
Okay, I was just saying that talking about the data, we should concentrate on real world data, because that is what is actually very important. Thank you.
And I would just add here, I think that, yes, this is a great discussion. And in one of the comments of Dr. Alangaju that I would like to bring to the table is very important, and that is the accountability issue. We've talked about the individual level, but it goes up and it goes to the country level. And one of the big issues is countries taking a commitment to make their healthcare systems go green and become carbon neutral. And what we need to realize as rehab providers is that we actually have been a little bit slow to this table. This issue has really been discussed a lot more in acute care, but I think moving forward, we've got to start talking about these issues as a rehabilitation team and use that big data, but then also, as Adesola said, make things practical. So I think this has been a wonderful discussion, and I think we're well poised. Our next episode, again, is going to be people with lived experience of disabilities talking about climate change. But then in our final episode, we're actually going to have people from other healthcare areas talking about these issues, the issues of mitigation, and how in rehabilitation we can learn from other healthcare providers that have already started this quest. So I want to thank you all. We really appreciate your attendance today. Thank you, Tiffany. Thank you, Andrew. Thank you, Adesola. And especially thank you guys for participating and enjoying and joining our workshop. And thank you to Haley Campbell and Cece Sorensen at GCCHE. Everybody have a great day.
Thank you.
Thank you.
Thank you.